of the Kenya Medical Association. Thank you very much for staying with us, Dr. Were. Now, you were talking about having universal health care as a country, and this requires strengthening of the health system, especially in Kenya, you know, coming at a time where we have lack of enough doctors, lack of enough equipment. Are we really prepared? Are we well equipped to achieve and attain this goal?
I can say in terms of preparations, a lot of work has gone into preparing for the rollout of the universal health cover. I was lucky to participate in it as part of one of the regulatory bodies of the government. The problem that now is arising and might reverse the gains is the lack of involvement of other players in the sector, because you cannot purport to want to implement a universal health cover plan without the involvement of the service providers. And when I talk about the service providers, we're talking about most of the private sector who are going to be very instrumental in implementing this universal health cover. I'm talking about involvement of the healthcare professionals' representation in this rollout plan. So I think what is important is we need to come together, the Ministry of Health, to work together with the medical professional associations and other representatives or stakeholders within the healthcare sector, so that we can be able to learn from the lessons of the pilot and then move together in terms of implementing the UHC. There's a lot of investment that will be needed to strengthen the healthcare system to come in, and I think with the public-private partnership, then we can be able to achieve this if everyone is brought on the table and we discuss this for the good of the country.
All right, so then is there any policy or are there any policies that Kenya can borrow from other countries and implement them well to ensure that this succeeds?
Yes, there are different countries that have actually implemented universal health cover way back from, for example, in Germany, they've had a universal health cover that they've been implementing for more than 200 years now. There is the Thailand universal health cover scheme that has been implemented, and we can be able actually to go and look at what has happened in Thailand, what has happened in Singapore, what is happening in Germany, that we can be able to borrow depending on the strength of our local economy and be able to implement so that we can be able to have everyone having equitable access to quality healthcare in this country. So there are many examples all over the world that we can be able to borrow, and I'm aware that actually most of the leadership of the Ministry of Health actually went into these countries and actually saw the good work that they're doing. And I believe, as one of the leading economies in Africa, that we can be able to lead in implementation of the universal health cover plan in this continent.
All right. Even as we conclude, we are aware that health is a devolved function, and this was mainly meant to increase access to quality healthcare and boost financial risk protection. Talk to us about the challenges that, you know, devolving health has come with.
I think the devolution of healthcare in this country was well thought. The problem has been the implementation and the involvement of stakeholders in the sector towards ensuring that it's well implemented. It's very worrying to note that since the devolution of healthcare has happened, the Council of Governors has never sat down with the professional associations and other stakeholders in the health sector to discuss on how to properly manage, how to properly support the devolution of the health sector. And this is why you are seeing, like the report you've just talked about in West Pokot, where patients are buying drugs, patients are buying other gloves so that they can have service. There's shortage of healthcare workers. And I think this we can only be solved if we sit together as professional association, as the Council of Governors, as the Ministry of Health, and come up with solutions that work best for all parties, because you're talking about West Pokot, but the reports that we have from our divisions all over the country, the situation is dire in most of the hospitals. You'll see most county governments investing in infrastructure. And if I can give you an example, during the COVID pandemic, we have seen buildings coming up. We have seen ICUs, beds being bought. But what is shocking, and you've been seeing in the media, like in the metropolitan area, we only have 30 ICU beds for COVID patients. And even these ICU beds, the infrastructure they have bought, are not, the rest are not functional because we do not have the accompanying human resource aspect. And this can only be solved if we come together and agree what is our need in terms of operationalization of this infrastructure that you have invested in. Look at the MES plan. We bought very good equipment that are now not being used because we don't have enough radiologists to operate this equipment. So I think what needs to be done is the Ministry of Health needs to take leadership together with the Council of Governors, because health is a devolved function, and then we review together what is working, what is not working. But as we have always recommended, we need to free the county governments from the recurrent expenditure, which runs into billions, of paying healthcare workers, and return that function to the central government so that the county governments can be able to focus on delivery of healthcare services without having to spend all the money that's allocated from Treasury in payment of salaries.
Right. Thank you very much, Dr. Were Onyino. Just from